How to improve gut health in autism. How can we enhance gut health in individuals with autism? This question is important, especially since many people with autism experience digestive issues like irritable bowel syndrome and colitis. These conditions can make managing gut health a priority. First, let's consider the connection between the gut and the brain. The microbiota gut-brain axis shows us that what happens in the gut can affect brain function and behavior. This means that improving gut health might also help with some autism-related behaviors. One effective way to improve gut health is through dietary changes. A low-inflammatory diet can be beneficial. This often means cutting out common irritants like gluten, which is found in wheat and some grains, and casein, which is in dairy products. Many individuals with autism report feeling better when these foods are removed from their diets. Incorporating high-fiber, plant-based foods is another great approach. These foods help promote the growth of good bacteria in the gut, which can produce short-chain fatty acids that nourish the gut lining and reduce inflammation. However, it is important to introduce fiber gradually, especially for those with sensitive stomachs, to avoid worsening symptoms of irritable bowel syndrome or colitis. Some individuals may find a ketogenic diet helpful. This diet is high in fats and low in carbohydrates. Some studies suggest it may help reduce anxiety and improve social behaviors in autism. However, this diet should be supervised by a healthcare professional due to its restrictive nature. Probiotics and prebiotics can also play a role in improving gut health. Probiotics are live beneficial bacteria that can restore balance in the gut microbiome. Specific strains have shown promise in easing gastrointestinal symptoms and may even positively influence behavior. Prebiotics, which are non-digestible fibers, help feed these good bacteria. They can support a healthy microbiome but should be introduced carefully to avoid triggering digestive flare-ups. Another emerging option is fecal microbiota transplantation. This involves transferring stool from a healthy donor to the patient's gut to restore microbial balance. Some studies have reported improvements in both gastrointestinal symptoms and behaviors in children with autism after this procedure. However, it is still experimental and should be approached with caution. It is also essential to manage antibiotic use carefully. Antibiotics can disrupt the gut microbiota, potentially worsening dysbiosis. This is particularly important for individuals with autism who may already have imbalances in their gut bacteria. For those experiencing symptoms of irritable bowel syndrome or colitis, direct management of these symptoms is crucial. This can involve medications, stress reduction techniques, and dietary adjustments. Reducing inflammation and discomfort can improve nutrient absorption and overall well-being, which may also positively affect behavior and cognitive function. Lastly, working with healthcare providers who specialize in gastroenterology and autism is vital. They can tailor interventions to meet individual needs, monitor progress, and adjust treatments to avoid worsening sensitive stomach conditions. Improving gut health in autism involves restoring balance in the gut microbiome, reducing inflammation, and managing sensitive digestive symptoms through diet, probiotics, and emerging therapies. These strategies aim to relieving gastrointestinal discomfort and may also improve behavioral and neurological symptoms associated with autism. Careful management is key to supporting overall gut and brain health.